Polycystic ovarian disease is a hormonal disorder that affects about 20% of women in their reproductive age group. Although there is no actual cure for PCOS, lifestyle changes like healthy eating, regular exercise, and stress management can help maintain symptoms. Diet and lifestyle modifications are the primary treatment approaches for a woman with PCOS. A systematic review and meta-analysis found that the type of diet didn't matter as much as losing weight. Losing weight improved both the metabolic and the reproductive parameters associated with PCOS. Eating plans that include foods with a lower glycemic index and glycemic load, or modifying carbohydrate, fat, or protein amounts have been shown to reduce metabolic markers which are associated with PCOS. In fact, even with weight loss, it has helped a lot of patients. Now, compared with women without PCOS, women with the condition have higher levels of insulin and inflammatory markers. A balanced diet consisting of 5 small meals with 25% protein, 25% fat, and 50% carbohydrates has shown to be very beneficial for these women. This diet was designed to include moderate to high amounts of fibers with an emphasis on anti-inflammatory foods such as fish, legumes, green tea, and low-fat dairy. All this while limiting red meat and added sugars. The results showed significant reduction in cholesterol, blood pressure, and fasting glucose levels. The levels of C-reactive protein were reduced by 35%, and about 63% of these women also regained their menstrual cyclicality. The DASH diet, also known as the dietary approaches to stop hypertension, which is also designed to be rich in antioxidants, has been investigated for women who are having PCOS. Women who followed the DASH diet for 8 weeks saw reduction in insulin and CRP levels along with improvements in waist circumference measurements. But before we dive into that, make sure you subscribe to my channel and also click the bell icon so you don't miss any of my future videos. N-acetylcysteine, or NAC, is a powerful antioxidant and an amino acid. It is a derivative of L-cysteine, a precursor to glutathione, and it is involved in fighting oxidative stress and inflammation. NAC has also been shown to protect insulin receptors and influence insulin receptor activity and insulin secretion from the pancreatic cells. A systemic review and meta-analysis showed that NAC improves BMI, total testosterone, insulin, and lipid levels equal to what metformin does in women with PCOS. Inositols are pseudovitamins found in foods such as fruits, beans, and cereals. Myoinositol and decaroinositol work as secondary messengers that regulate activities of the hormones including FSH, thyroid stimulating hormone, also known as TSH, and also insulin levels. It is believed that women who have PCOS have a defect in the ability to use inositols properly, which could perhaps be a reason of why they have higher insulin levels. Both myoinositol and decaroinositol have been well studied with women who have PCOS and have shown promising results as a first-line therapy for all of these women. Myoinositol in particular has been shown to improve insulin sensitivity as well as egg quality and ovulation. Research is also showing that a combination of myoinositol and decaroinositol in the ideal ratio of 40:1 mimics the body's own tissue levels and works better than inositol alone for improving metabolic aspects and restoring hormonal balance. Studies on PCOS also show an inverse relationship between vitamin D and metabolic and hormonal disorders. Vitamin D receptors have been located on oocytes, immature ova, or egg cells involved in reproduction. Vitamin D supplementation have been shown to improve the fertility in women with PCOS by increasing the number of mature follicles and improving menstrual regularity, but more data is required to make it a recommendation yet. Fish oil offers many benefits to women with PCOD, including helping the reduction of elevated triglyceride levels, improving fatty liver, and also decreasing the inflammatory markers. Omega-3 oil has been found to lower testosterone and regulate menstrual cycles in both overweight and also in lean PCOS women. Results from the Diabetes Prevention Program outcome study shows that metformin affects the absorption of vitamin B12 by causing alterations in the vitamin B12 intrinsic factor complex in the ileum. Consequences of decreased vitamin B12 concentrations such as microcytic anemia, neuropathy, and mental changes can be profound. Since the average dose of metformin in a PCOD woman is high, it is recommended that patients who take metformin have their vitamin B12 levels checked annually and supplemented with vitamin B12 if required. Medications like birth control pills can help regulate menstrual periods and reduce its symptoms. These medications can be effective in managing PCOS, but they should always be used under guidance of a healthcare provider. If ovulation and pregnancy is your only concern, taking medication to force an ovulation or a laparoscopic PCOD drilling to clear out the cyst or undergoing an IUI or an IVF will help speed up the process of pregnancy. A very interesting study that was published in the Fertility and Sterility found that the risk of disordered eating behaviors was more than 4 times greater among women with PCOS when compared to the controls. High insulin levels have been associated with increased cravings and binge eating behaviors as well. And a study published in The Appetite found that 60% of obese women with PCOS were categorized with binge eating behaviors. PCOS can also increase the risk of endometrial cancer, and this is a whole different topic. If you want me to make another video on that, go ahead and leave a comment down below. Remember that PCOS is a very complex disorder and its management requires a multidisciplinary approach. So if you or someone you know is struggling from PCOS, don't hesitate to reach us for help. That's it for the video. Thank you all so much for watching. I hope this information was helpful for you. Remember that by understanding PCOS and its symptoms, we can take steps to manage it and also improve our overall health and well-being. If you like this video so far, go ahead, give us a like and also share this with your friends and colleagues. Until the next one, see you and have a lovely day. Bye.